Well, hello there, it's Ingebird, and today I am going to teach you how to take care of your ostomy. Um, Lately, I've gotten a lot of requests from people who are about to get surgery. They're going to either get a colostomy bag or an ileostomy bag, and they have lots of questions and some concerns. So I decided to put this video together to demystify the ostomy and everything that goes along with it, especially the care and feeding. So this video is for you. Okay, let me start out by saying that there's lots of different reasons to get a colostomy or an ileostomy bag. I have a colostomy bag, and the reason I have mine is because I'm a cancer survivor. I do have my colon. However, the cancer destroyed my sphincter muscles, so the muscles that normally hold in stool no longer work. So I had a choice of wearing adult diapers the rest of my life or a colostomy bag. So I chose the colostomy bag. Let's see. The difference of the colostomy bag and an ileostomy bag is that a colostomy is attached to your lower intestine, and the ileostomy bag is up in here, and it's attached to your small intestine. So it's basically just a difference of geography. I'm pretty sure taking care of an ileostomy is very similar to cleaning and emptying your colostomy bag. However, if you have an ileostomy, you definitely need more hydration, so you got to drink lots more water, especially when it's hot. But of course, it's a good idea to stay hydrated anyway when it's really hot, because otherwise your stool will be constipated, and it's not that comfortable when it comes out of the stoma. And you'll learn what a stoma is in just a moment. So what I do is I change my bag 3 times a week, but I empty my bag several times a day. And it's just like using the bathroom. I want to make sure, though, as soon as my bag is about 25% full, I empty it, because if it gets fuller than that, the bag gets really heavy, and then you risk the bag opening up or the ostomy bag completely falling off, and it makes a huge mess. So let's start out by learning how to empty your bag. Now you're going to come up with a plan that works best for you. This is what works for me. I just get an empty cup here. Like, this is an old cup that I had hummus in. This is an old empty water bottle. I throw them out after a week. I clean them every day with a mixture of 25% bleach, the rest water, and I do that once a day just to sanitize it. And this is basically all I do to clean my bag. Now, of course, there's going to be some stool in here. There isn't right now. But that's what I do is put water in there. I swish it around, just kind of getting it all off the bag there. And I take my cup and I just empty it right in there. Okay? And I do that until I think the bag is clean enough for me. I seal it back up, and then I take the cup and I throw it in the toilet. And then I'll rinse it out one more time, or several times, and dump that back in the toilet. So I'm done with that. Okay, that's basically all I do when I clean my bag out. Okay, so today what I'm going to do is, of course, show you also how to change the entire bag. Now, I have a 2-piece system by Hollister. That's my brand. That works the best for me. There's several brands out there. You just have to figure out which one's best for you. Ask your ostomy nurse and your doctor, your healthcare professional, for different samples. These companies will send you these samples, and you'll just figure out which one fits best for you. So that's how easy. The bag just came right off. Now, the company that I get stuff for, my bags from, has actually a little baggie. It's just like a poop bag for people with ostomies. Then I just roll it up, clean that up. Now, I have a little bit of stool that's left around my stomach. So what I do is I just take a paper towel, I clean that up, okay, and I throw that in the toilet. And I just take regular soap. I don't get anything fancy. And I wash my stomach. Whoops, it's a little bit messy. And I just wash it off real good. And I take a washcloth, clean it up. You can, if you want, you can take a shower and clean your stomach that way. You know, whatever works best for you. If you want to do that, that's fine. I don't take a shower without my bag because your stoma works differently than your actual rear end with your muscles. There's no muscles in your stoma. Basically what it is your intestine. You see that? Kind of looks like a raspberry. That's the intestine sticking right out there. There's no muscles there. It's just as soon as the stool is ready to come through, it's going to pop right out. And I've had a couple accidents in the shower where all of a sudden it just started coming out, and then I had to bleach the shower, I had to clean it all up, so it was a big hassle. So for me, I'm not going to do that. I prefer to be at the sink. That way I can just take care of it there. Now I just take a towel and I pat it dry, and I'm going to wait a couple minutes for that to dry because you want the skin to be as dry as it can be before you put the wafer on. And this is the wafer right here, okay? That's the part that's going to go on the skin. Now you can buy wafers that are pre-cut. When you have surgery, it's going to take about 30 days for your stoma to really heal and become the size, that you want. I did that wrong because I'm talking at the same time. So basically, what this has here is a little thing on there. You see that? And that's where the cutout part is, so I can see how big I want my circle to be. Now, I mentioned before that when you have surgery, your stoma is going to constantly be changing. So you'll want to get one of these wafers that you can cut yourself to fit your stoma. Now, my stoma is about 1.25 inches wide, and I just prefer to cut my own every time instead of a pre-cut wafer because I just do. You do what works for you. Now I just take this. Okay, it's dry now. I can put this on. It takes not more than 2 minutes. And I place this over the stoma like that, and I push down. And I push down for about 30 seconds, okay? I want it to have a good seal. If you don't have a good seal, you're going to have breakage, and it's going to be a big mess. So this part here where the tape is, you want to make sure that's sealed really good next to your skin. Because if any parts are open and it breaks open and stool starts seeping out here, your whole thing is compromised. Your whole ostomy bag is compromised and you have to start over because it's not going to be able to be cleaned up. Okay. I have a little bit of a stool coming out, so I'm going to clean that up like that. Like that. Poop baggie. Throw all this stuff away. Now, I have this thing called Adapt, this product called Adapt. It's basically a deodorizer. It also keeps the bag from sticking next to me, my skin and stuff. So what I do is, okay, this is the bag part here, okay? So what I do is I put the bag on. It snaps together. You make sure everything's, you hear the snap. Check it all the way around. Now, I can do this pretty fast. When I first had my bag, it took me about 15 minutes, so it's going to take you longer. Don't worry about it. You'll get faster as time goes on. Okay, now I open the part here of the bag, and I'm just going to squirt in about a teaspoon of this Adapt. And just squish it around, squish it all around. This kind of helps keep the stool from sticking to your bag and making it so messy. It kind of foams up a little bit like soap. Don't put anything else in here other than what your doctor says you can have, okay? Because the stoma can get infected, you can start bleeding, so don't mess around with anything else like baby oil or anything like that, okay? Just don't do it. All right, here you go. We're going to roll it back up until it snaps shut. And you're done. Your bag is all set to go. Now, let's say you want to do sports. You can do anything you want with a colostomy bag that you did before you had one. You can do swimming, you can do track, you can do surfing, golfing, anything that you did before, you can do with a bag. I would suggest, though, to make sure your bag is more secure is to get the belt. You can get a belt from your medical supply store, the one that supplies the ostomy bags. And basically, it just snaps right on. See this part here? It's going to snap right on to the wafer. Is it the wafer? Right here. Or to the bag, I'm sorry, not the wafer. And you're going to put it around. Snap it right there. That's just to make sure nothing pops off. Okay? And you're good to go. Okay, so now you've got a little bit extra. It's like having suspenders. You've got a little bit extra protection if you're going to be doing some physical activity. You can also play football. Okay? There's lots. You'll be surprised how many people have colostomy bags and ileostomy bags. You can also get a belt for your ileostomy as well. Here's something else that you can use. It's a little white powder. You're going to get this from your doctor or your the people that you buy your ostomy supplies from. Let's see, make sure. See that real good. Okay, hopefully you can see that. This is a white powder that you're going to put on in case you get a rash, and that can happen sometimes because if the stool comes out, and let's say you have a breakage in your wafer and it starts coming through, well, your stool is acidic, so it's going to burn the skin, and sometimes you'll get a rash, sometimes you'll get a yeast rash. And so anyway, what you want to do is you're going to put some powder on there. I suggest when you put the powder on your stoma, you're going to lay on your back and make sure your skin's dry, and you're just going to tap it out real carefully. You're going to let it sit there for about a minute, and you're going to blow the rest of it off. And then you can go ahead and put your wafer on in your bag, and you're good to go. Something else I have, I carry this in the trunk of my car, and then I put it in my backpack if I'm going inside. It's just basically a little bag that I have. I got this actually from the Ostomy Supply Company, but you can use a makeup bag, any kind of little small bag that you want. It just basically has an extra supplies in there, just in case you have breakage and you won't be on the spot. So basically, that's about it. Taking care of your stoma is really easy. And if you have any other questions for me, please leave a comment at the bottom of the video, and I'd be happy to get back to you. And gosh, I can't think of anything else that you would really need to know right now other than, hey, it's going to make your life better. I guarantee you. Here's a question I know someone else had asked me about. If you go on the internet, there's actually companies that make lingerie and underwear and swimming special swimsuits just for people with ostomies. All you gotta do is type in ostomy undergarments or ostomy swimwear, and you're going to find lots of different companies pop up. There's lots of different things to hide this ostomy bag, so when you have 6 of them. Nobody will even notice that it's there. It's very discreet. I think even Victoria's Secret has some really nice lingerie for the ladies. And I'm not sure if they make stuff for the men, but just type it in and see what's available. You can really be pleasantly surprised that your ostomy is not going to end up being such a big deal, but it's going to make your life better. So I hope this video helped you and helped demystify having an ostomy. And like I said before, if you have any other questions, just leave a comment at the bottom of this video and I will get back to you. All right, have a great day and thanks for watching.